So I've heard that you have this teeth whitening that you offer at your office. Can you talk to me more about what this is? And I've heard it's permanent.
The teeth whitening that I love to offer my patients is called core whitening, K-O-R. And over the years, I've done a lot of research on the best whitening system, because what I had seen in the past was that we'd do a whitening session and then 6 months later, the color would just revert back to its original color. So that was quite frustrating. And, and I didn't feel comfortable offering a service and charging for it, and then the patient is just not satisfied. So in my discovery, I came across core whitening. And basically, it used to be called deep bleaching. So the name just makes more sense because what it is, it's basically 2 weeks of nightly whitening. And the formulation is such that each night, the whitening material goes in deep inside the dentinal tubules, and it gets trapped in there. And so after about 2 weeks of nightly whitening, you come in for an office visit for 2 hours, and we top it off with our in-office whitening, and you will see phenomenal results. Now, because it goes so deep inside those dentin, that's how it stays for a very, very long time. And, they have some ingredients in there which helps with sensitivity, because a lot of patients are concerned about that. So we're able to help those patients as well. And all you need to do is, once the procedure is done, you keep your trays, and then you just pop your trays in once a month, with the whitening material that we provide. And that really helps maintain that color.
Wow.
It's really good. I've treated patients who have tetracycline stains, which is a deep ingrained dark brown color that they were just born like that. And so we have been able to help those patients, because the other option is to do veneers for those patients, and not everybody wants veneers.
So you said it's 2 weeks worth of nightly trays.
Yes.
And you keep them in all night? Or is it just...
Yeah, you keep them in all night, So there's like certain protocols that you have to follow, you have to follow the technique of placing a desensitizer, and then those trays are very customized. So why it's customized is that the bleaching material stays trapped in the trays, and so it doesn't allow it for it to escape, and the saliva doesn't get in. And so it's doing its work all night. And so you're just basically sleeping with them. The trays are very thin and they're very comfortable. And so the patients are very, very satisfied.
I have to ask though, what's the difference between that and like the trays that you get at like the grocery store?
So the trays that you get from us, we take a digital scan of your mouth. And then the trays are made at the core whitening laboratory, in which they're custom fitted for you, and the area around the gum line is contoured such that it gets suctioned. And so the bleaching material is not able to escape, and you have a good fit.
Wow.
So that's the difference, because in the grocery store, it's like a one size fits all.
Right.
And all the bleach just kind of oozes out.
Right. And then you taste it.
Yeah, and you taste it. And then once saliva and the bleaching material, they mix, it stops working. It's the material and the tray fabrication that makes the difference.